So today we will discuss wrist joint. Okay, wrist joint and main first carpometacarpal joint of the hand. We'll just know the names of other joints of the hand and detailed discussion of the wrist joint and first carpometacarpal joints. Okay, so see, this is the wrist joint. Okay, it is formed between the lower end of radius with the articulating disc at the lower end of ulna with the first row of the carpal bones. Okay, proximal row of the carpal bones, mainly three carpal bones: scaphoid, lunate and triquetral. These are together forming the wrist joint. So wrist joint also known as radiocarpal joint because only radius is taking part in formation of the joint. Ulna is not taking part in formation of the joint. A triangular articular disc is intervening between the head of the ulna and the wrist joint. Okay. So subtype is ellipsoid variety of biaxial joint. This you have to remember. First you have to say synovial joint, and what type of synovial joint? You have to say ellipsoid type of synovial joint, and movements are biaxial. Movement occurs against two axes. Okay. Next, wrist joint complex is formed by the radiocarpal joint and the midcarpal joint. Here is the radiocarpal joint and this red colored line represents the midcarpal joint. Okay. So these are the articulating surfaces you see. Here is the triangular articular disc. This is one collateral ligament, ulnar collateral ligament. So above the articulating surface is formed by distal end of radius. Here is the distal end of radius and the articular disc of inferior radioulnar joint. This is articular disc of inferior radioulnar joint. These are forming the proximal surface or the surface above. Okay. And below it is formed by the scaphoid, lunate and triquetral. Here is the scaphoid, lunate and triquetral. From lateral to medial, from the side of radius, medially we are going. Okay. So these bones are together forming the wrist joint. The proximal articular surface forms an ellipsoid concave surface and in which fits the distal ellipsoid convex surface. Okay, forming the wrist joint. These are the important ligaments of the wrist joint. First is capsular ligament. Here innermost will be the capsular ligament just surrounding the joint cavity. Next is the palmar ligaments, dorsal ligaments and collateral ligaments. See here this red colored one representing the palmar radiocarpal ligament. Okay, so we are viewing from the front here. Dorsal will be on the posterior aspect and on the two sides the collateral ligaments. Medial side ulnar collateral ligament, lateral side radial collateral ligaments are present. Okay. So capsular ligament encloses the joint and is attached above to the distal ends of radius and ulna and below to the proximal row of carpal bones. Synovial membrane lines the capsule and it is attached to the margins of the articular surfaces, and the joint cavity does not communicate with that of the distal radioulnar joint or with the joint cavities of the intercarpal joint. So it has a separate joint cavity. Okay. And there is a formation of recess known as pre-styloid recess just in front of the styloid process. So ligaments are, these are important ligaments: palmar radiocarpal ligament, palmar ulnocarpal ligament. Okay, here is palmar radiocarpal ligament, palmar ulnocarpal ligament. Dorsal radiocarpal ligament will be on the posterior aspect. Radial collateral ligament, yellow one is the radial collateral ligament and the green one represents the ulnar collateral ligament. Okay, understood? So you have seen these ligaments. Now we are going to different relations. See, this is a cut section through the base of the hand here. Here you have cut, transverse section at this level. So these are the section of the bones. So these structures are lying in front of the wrist joint and these structures are lying posterior to the wrist joint. Okay. So anteriorly these tendons are lying. So what are the tendons? Tendons of flexor digitorum superficialis. These 4 tendons are of flexor digitorum superficialis, flexor digitorum profundus, 4 tendons of flexor digitorum profundus. Here is the flexor pollicis longus, flexor carpi radialis here, flexor carpi ulnaris, and median and ulnar nerve. Median nerve beneath this flexor retinaculum. Okay, and ulnar nerve passes superficial to the flexor retinaculum. Okay, so this part is forming the carpal tunnel. These tendons, all these tendons, flexor digitorum superficialis, profundus, flexor pollicis longus, flexor carpus radialis, and ulnaris. Ulnaris is ending just in front of the flexor retinaculum. So all these tendons are passing through the carpal tunnel. Okay, and this median nerve is passing through the carpal tunnel, and this ulnar nerve and ulnar vessels are passing superficial to the carpal tunnel. So these are important structures passing superficial to the flexor retinaculum and structure passing deep to the flexor retinaculum are very important viva question. Next is laterally there is radial artery. Okay, here is the radial artery. Next we are going to posteriorly. Posteriorly there will be mainly extensor tendons and abductor pollicis longus, extensor pollicis brevis, extensor carpi radialis longus and brevis, extensor pollicis longus, extensor indicis, extensor digitorum. These are the 4 tendon of extensor digitorum and extensor indicis. Okay, in single sheath, and extensor digiti minimi, extensor carpi ulnaris. These are lying in separate 7 compartments. Okay, all these tendons are lying from lateral to medial, that means from thumb side to the little finger, in 7 separate compartments. Okay, understood? These are also asked in your viva. Next we are going to the blood supply. Okay, blood supply, it comes from anterior and posterior carpal arches. Carpal arches are palmar carpal arch. There you will see during the palm dissection some superficial palmar arch formed by the radial and ulnar arteries, branches of radial and ulnar arteries. And deep palmar arch will lie at a deeper plane beneath the tendons. Okay. Next is the nerve supply. Nerve supply comes from 2 interosseous nerve, anterior interosseous nerve and posterior interosseous nerve. Anterior interosseous nerve is branch of the median nerve, posterior interosseous nerve branch of the radial nerve. Okay, so these are supplying the wrist joint. Next we are going to different movements of the wrist joint. Movements are very important. You will be asked to show these movements during your viva table, bones viva. Okay, understood? So you practice the movements. So this is abduction and adduction. Adduction is towards the midline of the body, abduction is away from the body. Abduction and adduction. Okay, next this is the anatomical position. This will be the flexion. Okay, and posteriorly going, this is extension, and more posteriorly hyperextension. Okay, so these are movements are permissible in the wrist joint. So one movement, this adduction and abduction is occurring around anterior posterior axis, and this flexion and extension is occurring around a transverse axis. Okay, so around 2 axes the movements are occurring. Okay, understood? So that's why it is a biaxial joint. So what are the muscles involved in the joint? That is also important. Okay, prime movers you must remember. So flexion is mainly occurring at the mid carpal joint. Okay, and range of flexion is almost 0 to 60 degree. You can see up to this level you can flex. Okay, more flexion needs more pressure. Normally you can flex up to 0 to 60 degrees. Okay, so this is the range of flexion. Muscles, primary muscles involved in flexions are the flexor carpi radialis, flexor carpi ulnaris and the palmaris longus. Next, it is assisted by flexor digitorum superficialis, flexor digitorum profundus and flexor pollicis longus. Okay. Next, we are going to the extension. Extension is range is 0 to 50 degree and it is mainly occurring at the wrist joint. Okay. These two joints were forming a complex mainly, wrist joint and the mid-carpal joints. So, flexion, extension, all these are occurring at these two joints together. Okay. So, main muscles involved in extension are the extensor carpi radialis longus, extensor carpi radialis brevis and extensor carpi ulnaris. So, towards the radius, two muscles are present, one longus, one brevis. Towards the ulna, one extensor carpi ulnaris. And it is assisted by rest of the extensor muscles, extensor digitorum indicis, extensor digiti minimi, extensor pollicis longus. Okay, understood? Next, it is the abduction away from the midline. Abduction is occurring at mid-carpal joint and range of movement is 0 to 15 degree. And the muscle involved are the flexor carpi radialis, extensor carpi radialis longus and brevis. Okay. And it is assisted by these muscles. These are muscles of the thumb mainly. So, these are, and they are lying on the lateral side. So, these muscles are helping. So, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis. This helps in the abduction. Next, we are going to adduction. Adduction occurs mainly at wrist joint and range is about 0 to 50 degree. Okay. And the main muscle involved are the flexor carpi ulnaris, extensor carpi ulnaris. Next is the circumduction, another movement. Okay, it is combination of flexion, adduction, extension and adduction. Okay, you can rotate it like this. So, this will be the circumduction. You have to show, okay, circumduction, all those movements, flexion, extension, hyperextension, adduction, abduction. Understood? So, circumduction is combination of flexion, adduction, extension and abduction. Shoulder joint is done. Okay, so circumduction you have also seen in shoulder joint also. Okay, for every joint you practice the movement. Shoulder joint movements are very, very important. It is asked flex, you have to ask flexion, extension, adduction, abduction, circumduction, all will be asked in your viva. Okay. Next, we are going to joints of the hand. Okay. First is mid-carpal joint. Here is the mid-carpal joint. Between it is a ellipsoid joint and articulation between the proximal and distal carpal bones, rows of carpal bones. And there is intercarpal joints. Intercarpal joints are plain synovial joints and they are formed between the individual carpal bones of proximal row and individual carpal bones of the distal row. So, joints of the hand, their articulation of the hand is highly evolved in the humans for performing skillful movements. Human can hold a pen, pencil, needles and so on to perform skilled movement such as writing, drilling, craft preparation and so on. Very fine movement can be done. And joints of hand and all this involves the small joints of the hand. Okay, these are the joints, intercarpal joints lying between the individual carpal bones. Mid-carpal joints between proximal and distal row of the carpal bones. The violet line is representing the mid-carpal joint. Next is carpometacarpal joint between the carpal bones, distal row of carpal bones and the base of the metacarpals. Here is the carpometacarpal joint and here is the first carpometacarpal joint. This we will discuss in details because this is a different type of joint. It is saddle type of synovial joint. So, carpometacarpal joints, then there is intermetacarpal joints. Between these four medial metacarpals, these joints are known as intermetacarpal joints. Next is metacarpophalangeal joint. This occurs at the head of the metacarpals with the base of the proximal phalanx. Okay, metacarpophalangeal joint and interphalangeal joints between the phalanges, proximal and middle phalanx, middle and distal phalanx. Okay. So what are the type of joints? Type of joints you have to remember for your Viva and MCQs. Okay. So first carpometacarpal joint is saddle joint. Second to fifth carpometacarpal joint are plain type of synovial joint. This one is first carpometacarpal, this is saddle. All these are the plain type of synovial joint. Next is metacarpophalangeal joint. Here is the metacarpophalangeal joints. Okay, these are ellipsoid joints and interphalangeal joints. These are the interphalangeal joints. They are hinge joints. Okay, so these are different types of joints. So carpometacarpal joints, these are synovial joints between the distal row of carpal bones and bases of the metacarpals. And these are plain synovial joint except the first carpometacarpal joint, that is saddle variety of the synovial joint. Okay. The carpometacarpal joints are 5 joints in the wrist that articulate the distal row of the carpal bone and the proximal bases of the 5 metacarpal bones. So here is the location of the carpometacarpal joint. See here, trapeziometacarpal joint. Articulation is occurring between the trapezium and base of the first metacarpal. So first carpometacarpal joint of thumb is also known as trapeziometacarpal joint, and they differ significantly from other 4 carpometacarpal joints. So we will discuss this in details. First carpometacarpal joint is the joint between trapezium and first metacarpal for thumb, and type of joint is saddle variety of synovial joint, and articular surfaces are proximal. Proximal surface is inferior surface of the trapezium here, and distal surface is superior surface of base of first metacarpal here. So both the articular surfaces are reciprocally concavo-convex. Okay, that's why it is saddle joint. This term you remember. They are reciprocally concavo-convex. Okay, some part is convex, some part is concave. Here also some part is concave, some part is convex. Okay, and they fits with each other. That's why it is called reciprocally concavo-convex. Okay. Hence it is saddle joint, and shape of the articular surfaces permits free movement at this joint. Here is the first carpometacarpal joint, saddle variety of synovial joint because the articular surfaces are concavo-convex. Articular surfaces are distal surface of trapezium, proximal surface of base of first metacarpal, and the articulating surface of trapezium is concave in the sagittal plane and convex in the frontal plane. And the concavo-convex nature of the articular surfaces permit a wide range of movement because movement of thumb is occurring in different plane. Okay, so this wide range of movement is possible because of this articulating surface. Okay. So these are the ligaments present in this joint. First is capsular ligament. This is thick fibrous sac attaches with the margins of proximal and distal articular surfaces. Synovial membrane lines the inner surface of the capsule. So if you prepare short note, first carpometacarpal joint. Okay. So these are synovial membrane lines the inner surface of the capsule, capsular ligament. Then there is another lateral ligament. Lateral ligament is a broad ligament, extends from lateral surfaces of the trapezium to the lateral side of base of the first metacarpal. Okay. Next there is anterior and posterior ligaments. These are oblique bands, extends from anterior and posterior surface of trapezium toward the medial side of base of first metacarpal. See here, capsular ligament is thick here. Okay. Capsular ligament is thick but loose and is thickest dorsally and laterally. Lateral ligament is broad band, strengthens the capsule laterally. Anterior ligament and posterior ligament is also present. Posterior ligament is oblique band running downward and medially. See, this one is posterior oblique ligament have been shown. Here superficial anterior oblique ligament have been shown. So what are the relations of the first carpometacarpal joint? Anteriorly there will be muscles of thenar eminence. See, this prominence is the muscles of the thenar eminence. Posteriorly there will be extensor pollicis longus, extensor pollicis brevis. Medially there will be radial artery and first dorsal interosseous muscle. Laterally tendon of the abductor pollicis longus. Anteriorly the joint is covered by thenar eminence, posteriorly long and short extensor of the thumb, laterally tendon of abductor pollicis longus, and medially there will be first interosseous muscle and radial artery. Okay. See here, this is extensor pollicis longus going to distal phalanx of the tongue. This is extensor pollicis brevis going to proximal phalanx of the thumb. And this is abductor pollicis longus. And this area forms the anatomical snub box. Okay. Next we are going to blood supply and nerve supply. Blood supply for this joint is coming from the radial artery and nerve supply is coming from the median nerve. Laterally there is median nerve. Okay. Next is blood supply, radial vessel supply blood to the synovial membrane and the capsule of the joint. And in this diagram you see the arches, palmar arches. This one is superficial palmar arch and this one is deep palmar arch. Okay. These arches are giving supply to different joints, wrist joint, other different joints of the hand or muscles or vessels of the hand. Okay. So nerve supply is first digital branch of median nerve supplies the capsule of the joint. Palmar cutaneous branch is supplying the blue colored area and digital cutaneous branch is supplying the green colored one. Okay. From the palmar aspect they are going to the dorsal aspect to supply the lateral 3.5 fingers. Next we are going to movements. Movements is important. You will be asked about the movements. Okay. So sidal variety of synovial joint permits variety of movement. Metacarpal does not lie in the plane of palm. This first metacarpal does not lie in the plane of the palm. It lies in anterior position and medially rotated 90 degree. Okay. Hence the movement of thumb, that is first metacarpal, takes place at right angle to the corresponding movement of other metacarpals. See this movement, flexion and extension occurring in the plane of the palm. See, this is anatomical position. So this will be the flexion occurring in the plane of the palm and this is the extension. So flexion and extension occurring in the plane of the palm. Next, this is abduction. Okay, occurring at a plane 90 degree with the palm. This is abduction, this is adduction. Okay, abduction and adduction, and this is the opposition movement. So, and circumduction, combination of all these, you can rotate it like this. So this will be the circumduction. Okay. So these movements are occurring in this joint. So flexion and extension occur in the plane of palm. Abduction and adduction occur in plane perpendicular to the plane of palm. Opposition occurs across the palm to bring the thumb in touch with the anterior surface of other fingers. Here this is showing opposition. This is abduction, adduction, extension, flexion. This is neutral position. And circumduction is combination of all the above movements. Okay, so you practice these movements. Now the muscle involved in these movements, flexion is done by flexor pollicis brevis and opponens pollicis. Okay, extension is done by extensor pollicis longus and extensor pollicis brevis. Abduction is done by abductor pollicis brevis and abductor pollicis longus, and adduction is done by adductor pollicis. Okay. Opposition is done by opponens pollicis and flexor pollicis brevis. Okay, understood? Some important points regarding this joint. Flexion of the first carpometacarpal joint is accompanied by its medial rotation, and extension is accompanied by its lateral rotation. And opposition is a unique feature of humans that helps in gripping, okay, gripping of some object. Now we are going to different clinical aspects. So osteoarthritis, first important disease of first carpometacarpal joint, is the common site of osteoarthritis in the postmenopausal woman. There will be degenerative changes and that occur with an advancing age. Painful, it is a painful condition causing loss of movement at this joint. Next is rheumatoid arthritis, chronic inflammatory disease of unknown etiology, and that results in warm, painful, swollen joints. Okay, commonly involves joints of the hands and the wrist joints. Next, you have to perform these movements of the thumb and maintain the responsible muscles. Okay, these are your duty to perform this. Next is first carpometacarpal joint can undergo degenerative changes with age, which is painful condition of the base of the thumb here, and this is known as dequervant stenosynovitis. Okay, dequervant stenosynovitis, in this condition movement of the thumb can aggravate the pain because it is causing pressure over the inflamed tendon. Okay. So we are summarizing the first carpometacarpal joint. It is a saddle variety of synovial joint. Articular surfaces are proximal is distal surface of trapezium and distally proximal surface of base of first metacarpal. Okay, see concavo convex articular surfaces. See here concavo convex. Okay, and reciprocal to each other. Ligaments are these four: capsular ligament, anterior ligament, posterior ligament, lateral ligament. Okay, and relations, movements, applied aspect, decurvant tenosynovitis we have discussed. And this is X-ray of the hand. Okay, so this is lower end of radius, styloid process. This is lower end of ulna, head of ulna, styloid process. So this part is the wrist joint. Okay. And here lies the articular disc. So the articular gap is more here. Articular disc cannot be visualized in X-ray. And these three bones are taking part in forming the wrist joint: scaphoid, lunate, and triquetrum. Okay, and this is pisiform, trapezium, trapezoid, capitate, and hamate, hook of hamate. And these are the metacarpal, first, second, third, fourth, and fifth. And these are the phalanges. And this is first carpometacarpal joint. Okay. Trapeziometacarpal joint. Understood? So these are important clinical aspects. Rheumatoid arthritis, ganglion formation. There will be swollen structure on the dorsum of the hand, dorsum of the wrist. Ganglion is swollen sometimes and it will be painful. Next, aspiration is done from the posterior surface between the tendons of extensor pollicis longus and extensor indicis. Okay. Immobilization is done in case of fracture in optimum position of 30-degree dorsiflexion. Okay. And next, one important clinical aspect. This comes in your explain why. Okay. In fracture of the scaphoid. In fracture of the scaphoid, blood supply to the proximal segment is lost. Okay. And there will be avascular necrosis of the proximal segment of the scaphoid bone. So fracture of the scaphoid, it occurs due to fall on the outstretched hand, fall on your hand like this. Okay, so this is fall on outstretched hand. There will be fracture of the scaphoid. Sign and symptoms will be tenderness in the anatomical snap box. Complication is avascular necrosis and the arthritis. Okay. Next is Colles fracture and Smith's fracture. These are also important clinical aspects. Comes as a part of long question or explain why. Why dinner fork deformity occurs in Colles fractures like this. Okay. Colles fracture is fracture of the lower end of radius. Okay. Distal fragment is displaced posteriorly and it is caused due to fall on the outstretched hand. And there will be dinner fork deformity. See here. This is here the fracture is occurring at the distal end of radius, and the distal fractured fragment is displaced posteriorly. So it will form the D nerve of deformity. This arrow is signifying the displacement of the fracture segment. And in Smith fracture, the distal fragment is displaced anteriorly. Okay, so this is Smith's fracture. Okay, understood? Okay, so this is the difference between the Colles fracture and Smith's fracture. Okay, so you have understood these two topics. Okay, any queries from these two topics? No queries? Okay, so you have brought your books? Yes or no? Yes, okay, so you prepare a short note right now for first carpometacarpal joint and submit it. Okay? Understood? Everyone write down in your copies and submit it to Avinas. And no one will leave before 3:30.